Hello. Capgras syndrome is also known as Capgras Delusion or Imposter syndrome. This is a rare condition where an individual believes that somebody close to them, who could be their spouse, a family member, a close friend, or even a pet, has been replaced by a double or imposter. Sometimes people believe that there are more than two versions of a person. They believe that the person who is the imposter behaved just like the person whom the imposter has replaced, and also that they assume the role of the person that they have replaced. The belief is of delusional intensity, that is, nothing can be said to dissuade the person from the view. Capgras syndrome is not mentioned in either ICD-10 or DSM-5 classificatory systems. The Capgras delusion can be very distressing for the person experiencing it and also the person who's being accused of an imposter. I'm Dr. Beth Colby, a psychiatrist in London. Joseph Capgras was a French psychiatrist. He co-authored a paper in 1923 in which the syndrome was first described. The authors called it l'illusion de sosie, which literally means illusion of lookalikes. The patient was a French woman known as Madame M, who believed that her husband and also other people had been replaced by doubles. Capgras syndrome was initially assumed to be a purely psychiatric disorder and symptomatic of schizophrenia. However, today it's also understood as a neurological condition in which the delusion results from organic brain lesions or degeneration. The Capgras delusion is one of the class of delusional beliefs termed the delusional misidentification syndrome. These involve the misidentification of people, places, and objects. Delusional misidentification syndromes are selective and specific, so that only a few people, places, or objects are misidentified, and that the misidentification always regards the same person, place, or object. Patients with Capgras syndrome recognise faces and other visual stimuli. It's the central nervous system that scans the features of a face. However, when seeing a familiar face, patients with Capgras syndrome do not experience the emotional reaction to seeing the person and therefore think that the person must have been replaced. The emotional response normally observed would be autonomic skin conductance responses, and this is low in seeing people who are strangers and also low in Capgras syndrome. Doctors still don't know exactly how Capgras develops, but think a broken connection between the two systems prevents normal face, place, or object recognition. However, there are several theories on what causes Capgras syndrome. Some researchers believe that the cause is a problem with the brain, such as atrophy lesions or cerebral dysfunction. Some believe that it's a combination of physical and cognitive changes, in which feelings of disconnectedness contribute to the problem, whilst others believe that it's a problem with processing information or an error in perception, which coincide with damaged or missing memories. Patients with Capgras syndrome may exhibit violence and be dangerous. Risk factors for this are past history of aggressive behaviour, delusion against a specific person, and suspiciousness and hostility towards the person. There's no standard treatment for Capgras syndrome. The aim is to treat the cause, such as giving anti-dementia drugs to patients with dementia, antipsychotics and therapy to patients with schizophrenia, and surgery, if at all possible, for patients with brain lesions. Hope this has been interesting and informative. Thank you for listening. Bye for now.